Corner on Citizen 93.7 FM Abuja.
Woman don't cover, lower everybody.
Oh, yeah. What to do? Women's Corner is waiting just for you. Education, work, lifestyle, career, mentorship, and family too. We will tackle the issues, provide solutions, and see you through. Finding your voice, reaching high, and making an impact. Women's Corner, where knowledge can fly. Join us every Mondays and Wednesdays at 1 p.m. for inspiring stories and practical advice to reach all your glories. It's Women's Corner on Citizen 93.7 FM Abuja.
Woman don't cover, lower everybody.
A very good afternoon to listeners of Citizen 93.7 FM Abuja, and welcome to another episode of the program Women's Corner. Women's Corner is a program that comes your way every Mondays and Wednesdays. On Women's Corner, we get to talk about lifestyle, family, relationship, health, education, basically everything that has to do with women. That's what we discuss on this program. My name is Aisha Shoaibu Badegi.
And I am Esther, but you can call me your mini celebrity.
Esther, how are you doing today?
I am, I don't know the word to use. Okay. I am so sorry, I'm already late. I have never been in this hurry in my life before. It's like, it was looking like a do or die affair, but thank God I'm here now.
Oshe celebrity and Ajebota at the same time. Anyway, so today we're going to be having a very interesting conversation around PCOS. I'm not sure you even know the full meaning.
No,
but then, to do this discussion, we'll be doing it with Dr. Aliu Chapa. He's a consultant gynecologist working at the Jumai Babangida Aliu Maternal and Neonatal Hospital, Minna, Niger State. Thank you, Doctor, for accepting to be on this show with us. Thank you for always being there when we need you. Good afternoon, Doctor.
Good afternoon, sir.
Good afternoon. Thank you too. It's a pleasure to be here with you.
Okay.
Thank you.
So, Doctor, straight, I want to start with what is PCOS?
Right.
Yes. But I think polycystic ovary syndrome.
Okay.
And it's a heterogeneous collection of signs and symptoms that form a spectrum of disorders with mild presentation in some, but severe disturbance of reproductive, endocrine, and metabolic function.
Okay.
So we can see in medicine, when they say something is a syndrome, it means it's a collection of signs and symptoms. That is not just a single complaint.
Okay.
And diagnostically, we have the hallmark of this is three things. A woman presents with menses that is irregular.
Yeah.
She may tell you that she has not seen her menses for 3-4 months. Some go as long as 6 months, the menses will cease. That is one. And some of them will have what we call features of hyperandrogenism. They will have hair growth in abnormal places. You see women having hair growth in their chin, in their upper lips. Hair grow as far as the chest. That's what we call hirsutism. And the third one is infertility. Some will come down with infertility. So those are the various presentations of this PCOS. And as I say, it's a syndrome because there are several presentations, but these three are the major presentations of the condition known as polycystic ovary syndrome.
Okay. So, doctor, what are the root causes of PCOS and why is it considered a metabolic disorder, like you said?
Yes. The root cause, we will see, we can also say there are risk factors because the cause of it is polygenic. Because several older people that is familiar, that means something that can be given onto your children. If a mother has a history of PCOS, his children or her children are more likely to also come down with it. So
That means it's hereditary then.
a specific cause for PCOS. But there are risk factors. One of them is obesity. We found out that women that are obese with a body mass index of greater than 35 are more at risk of this PCOS. There is what we call insulin resistance or hyperinsulinemia. Those also have a high chance of having this PCOS. It is considered a metabolic disorder because of this disturbance of insulin, disorder of glucose. And we have found out that women with PCOS, and that's why it's a condition that should be taken serious, because women with PCOS tend to be at increased risk of having diabetes later in life. You may have dyslipidemia, they can have cardiovascular disorders, hypertension, and they can also come up with endometrial cancer. So it's a dysfunction in lipid metabolism, dysfunction in glucose metabolism. And that's why it's basically considered as a metabolic disorder, as an endocrine disorder, and as a reproductive disorder. So we can see it's a constellation of several symptoms. PCOS, in infertility, there are several causes, and we classify it as factors. Factors of infertility can be ovarian factors, ovulatory factors, it can be uterine factors, it can also be peritoneal factors. For PCOS, it is an ovulatory factors. Basically, how is a preparation for a woman to get pregnant? When a woman ovulates, there is no sperm to fertilize. 3, 4, 5, 6 months without even menstruating. So once you didn't ovulate, there is no egg to be fertilized. Definitely, there will be infertility. So that's the major difference between it and the other causes of infertility, because we call it it's an ovulatory dysfunction. It has a way of making the woman not to ovulate. There will be eggs. In fact, the hallmark of the diagnosis is polycystic ovaries. When you do a scan for the woman, you see several follicles, eggs, but the wall is so thick that the eggs cannot be released. And we know the release of egg is what is known as ovulation. So that's the hallmark of the problem with PCOS, and that's how it causes infertility for most women.
All right, doctor, thank you. I would like to ask you a question now regarding how you explain PCOS, right? Is there similarities between PCOS and Sheeran?
And
Sheeran syndrome.
hello?
Yeah, can you hear me, doctor?
Sheeran syndrome.
Yes.
It's known as Sheehan syndrome.
Sheehan syndrome, yes.
Yeah, Sheehan syndrome is also a cause of infertility, not even infertility, a cause of a global cause of hypothalamic pituitary axis dysfunction. What happens in Sheehan syndrome? Maybe a woman delivers, she loses a lot of blood, oxygen supply to the brain is impaired, loses that hormone. If the blood supply to that spot is impaired, that spot dies off. So that hormone is no longer produced. So in Sheehan syndrome, globally, the woman will not produce estrogen, will not produce progesterone, she will not produce FSH, follicle stimulating hormone, and hormone. So globally, the woman will not menstruate, and the woman will not have all other functions that are being controlled by hormone. So she's like sterile. So it's a different entity to PCOS. PCOS can be managed depending on the presentation. And in fact, for polycystic ovary syndrome, what we do is what the woman presents with that you manage. Because as I say, it's constellation of signs. If the woman presents to you that her own problem, she's not married, all she wants, you manage that. Some can present with features of hyper.
Okay, I get that. Doctor, are you there?
Hello?
Doctor, can you hear us?
Yes, if the woman presents any symptom the woman presents it, so we usually individualize management for PCOS.
Wow.
If it's menstrual irregularity, you manage. If it's infertility, you manage.
Okay.
Still audible?
Yes, you are, doctor.
Yes.
Okay, so doctor, is PCOS? I mean, can a woman with PCOS, can a woman have PCOS, right? But then she doesn't show all of these symptoms that you mentioned, like facial hair or cyst, like without showing it. Is it possible to also have this PCOS without showing some of the symptoms as you mentioned, or not showing all of the symptoms at all?
Yes, as I said, PCOS is is a accumulation of so many other signs and symptoms. So some women may not even have any sign except the ultrasound. You know, polycystic ovaries, you can't see it, you can't feel it, except you go for a scan and the doctor will tell you, this your ovaries appears polycystic. So that woman may not have any other sign, any symptom, no complaint, but she's having polycystic ovary. So strictly speaking, before the patient is diagnosed of polycystic ovary syndrome, it's better, we always want to have 2 out of 3 symptoms. So we just don't see one of the symptoms and tag the person as having PCOS. We want to wait for the other symptoms, at least one of them, before we tag. But it's possible for a woman to have PCOS without knowing it.
Okay.
It can just be diagnosed incidentally.
Okay, so doctor, what are the key diagnostic, criteria used by healthcare professionals to confirm that one has a PCOS?
What we call criteria, they call it a diagnostic criteria, known as Rotterdam criteria.
Okay.
Rotterdam criteria has 3, and all the diagnostic criteria want for you to have 2 out of it, so you can make that diagnosis. One is that anovulation and oligoanovulation. And how you know a woman is not ovulating, that normal. So in other words, a woman that's not menstruating regularly or is not menstruating at maybe she has to start 2 to 3 months before she. That's one criteria. Secondly is that hyperandrogenemia. You see a woman with features having hairs and hair growth, just like in a male pattern. We males have hair on the face and the chest. That they can also acne and alopecia. Those are signs of hyperandrogenemia. Whether it is clinically or you go and look at laboratory and you tell you that androgen. And you know androgens are male. So when you have a male higher than normal, that's the second. And the first one is that ultrasound.
Doctor, your voice is a bit low. Your voice is a bit low, so it's quite difficult to hear all of the things you're saying right now.
Can you hear me now?
Yes, but your voice is down.
Okay.
Yes.
I said there are the criteria for diagnosis known as Rotterdam criteria.
Okay.
Includes 3 criteria, and all you need is 2 out of the 3 to make your diagnosis.
Okay.
One is the first one is anovulation. That's the woman is not ovulating. And externally, how you know a woman is not ovulating is that she's not going to menstruate. So when you see a woman having menses in 2-3 months, that's one criteria. Then second, features of hyperandrogenism. The woman has excess of male hormones, so she's going to grow hair in abdominal place just like a man. That's the second criteria. Third is the ultrasound, where you do a scan and you see features of polycystic ovaries. So once a woman has 2 out of these 3, the woman is clinically diagnosed to have PCOS.
Okay, regarding all of this that you mentioned now, doctor, I have this quick question. Now, when a woman does family planning, that's child spacing, sometimes the monthly flow usually fluctuates for some women, while some women usually do have their monthly cycles every month, even while they are on family planning pills and even injections. Some women, like I said, do have this implants on or even get injections on monthly basis, but then their period isn't stable. Does it in any way also is it possible that PCOS comes in at that time? I mean, when a woman
No, it's not. The caveat I forgot to mention in this criteria is that you must have ruled out other causes of menstrual irregularities, other causes of hyperandrogenism before you are attributed to PCOS.
Okay.
So you understand. When you know that there is something that might have caused the menstrual irregularity, you shouldn't consider it as due to PCOS.
Okay, so doctor, I know that in everything there, especially Nigerians, we believe in a lot of, misconceptions and myths. Is there any misconception about PCOS that has to be addressed or that needs to be addressed right now? Doctor, did you get that?
Yes, I did get that. The network was breaking.
Okay, so I said, like, Nigerians, a lot of us believe in, there are a lot of common myths and misconceptions in basically everything in this country. Now, what are some of the common myths about, or misconceptions about PCOS that needs to be addressed?
Okay, the myth is, most women will tell you that they come to hospital, they come late. Now you now ask them, you don't see your menses every month. Why did you stay this long? They'll tell you their mom told her that's how her menses has been. Yeah, we know it's familiar, but not seeing your menses every month is not normal. It's not something you fold your hands and say maybe your grandmom or mom say that's the pattern.
Happened to my mom.
Menses in their family, so because of that, you'll not seek help. So any menstrual irregularity, you see your menses too frequently or infrequently, is a reason to visit the hospital. So there is nothing normal about not seeing your menses for 2 to 3 months.
Okay, doctor.
And also another misconception. The second misconception, you see a woman infertility, she will tell you that she has had miscarriages 11 times. And when you sit that down and take a proper, you now realize that all she's having is PCOS.
Wow.
PCOS, once there is a delay in menses, the next menses that comes 4 or 5 months later will come heavy. So most women will think they have been pregnant for 5 months and then they miscarried.
Oh.
So that's another misconception. A woman comes to you 11 times, all you think is just PCOS, she doesn't menstruate regularly, the menses comes, it comes heavy, she notes that as one miscarriage, menses go off again for another 5 months, she has a second, so she'll keep ticking. She has had 11, whereas she's never pregnant. For any woman, the confirmatory test for pregnancy is an ultrasound. So once you've not done an ultrasound, you can't beat your chest and say you are pregnant.
Okay.
All right, doctor. Now, what if a woman, usually before she had her regular menses and everything, and then maybe after a CS, the menses cease. Is that also, does PCOS have a play in something like that, or there's another medical condition attached to it?
No, PCOS has no cause of that. There is an entity called amenorrhea.
Okay.
That is absence of menses. When primarily you've never had menses, they call it primary amenorrhea. When you've been menstruating and then suddenly the menses stop, it's called secondary amenorrhea. And there are several other causes of secondary amenorrhea. Though PCOS is one of the causes. Okay. But as I said, if there is something you can attribute to the absence of menses, you shouldn't attribute it to PCOS. So PCOS can actually cause absence of menses, but since there is CS, most likely the absence of menses might be due to that cesarean section that the patient had.
Okay, Doctor, we'll
thank
go on
you.
a short break, and when we come back, the program Women's Corner continues on Citizen at 3.7 FM Abuja. Do stay with us.
Need a lift? Feeling low, bored, or confused?
Wants your dream to brightly glow?
Here is what to do.
Women's Corner is waiting just for you.
Education, work, lifestyle, career, mentorship, and family too.
We will tackle the issues, provide solutions, and see you through. Finding your voice, reaching high, and making an impact. Women's Corner, where knowledge can fly.
Join us every Mondays and Wednesdays at 1 p.m. for inspiring stories and practical advice to reach all your glories.
It's Women's Corner on Citizen 93.7 FM Abuja.
Woman don't suffer, lower everybody.
You're still going to Citizen at 3.7 FM Abuja on the program Women's Corner. And this afternoon, we're having hot conversations around the PCOS with Dr. Aliu Chapa, who is a consultant at the Jumai Babangida Aliu Maternal and Neonatal Hospital, Mina. Doctor, thank you for staying glued on this program and for accepting to do this with us. Now, Doctor, I have more questions for you. So, you said something that when a woman has PCOS, she doesn't ovulate, and that means she can't get pregnant. So are we saying that it's possible to get pregnant, but then the chances are slim, or entirely she can't get pregnant? She can't ovulate and get pregnant when she has PCOS.
Yes, PCOS has several symptoms. But if the woman is not ovulating, it's not going to get pregnant. Because ovulation means release of eggs. It is only after that egg is fertilized by the sperm that it becomes the zygote. But a woman can have PCOS, as I say, you need just 2 out of 3 because 3 diagnosis. They may have male patterns, they may have but she may still be okay. So we can have...
Doctor, your voice is a bit low. Sorry.
Hello, am I audible now?
Yes, you are.
Is the network?
Okay. We can hear you now.
Yes, I said, I say it's a syndrome, and
Yes.
a syndrome constitutes several symptoms and signs. So, possible the woman have PCOS, but she's still ovulating. In that case, she can still get pregnant.
Okay.
And that's why, as doctors, what we manage is not PCOS. We manage the individual presentation of the patient.
Wow.
The patient will tell you she has abnormal hair growth. She comes to you, she's already having her children. All you manage, she may have PCOS, but her PCOS is the one that ovulates. That means she doesn't have a problem with an ovulation. So you manage. A woman will come with infertility, you manage the infertility. A woman will also come with menstrual irregularities, you manage. But strictly speaking, if she's not ovulating, she's not going to get pregnant.
Okay.
You understand the explanation?
Yes. So what are the long-term health risks associated with unmanaged PCOS?
Yes, the long-term health risks is usually most patients with PCOS tend to be obese, most of them. So I know the problems with obesity. In fact, it's so dramatic that once a woman with PCOS comes with she's overweight, all you need to tell her is go and lose weight. And just a little bit, 10% of loss in weight, you see her menses becoming regular, even without taking anything. The long-term consequences of obesity, the woman can come out with diabetes, she can have hypertension, she have coronary heart disease, and she can also come down with endometrial cancer later in life. So that the long-term health risk of PCOS.
Okay, does PCOS affect a woman's mental health, including risks of anxiety and depression in any way?
Yes, PCOS on its own will not. But the effect of PCOS, assuming a woman has PCOS and she's infertile, she has not been able to get pregnant for 15, 20 years, it will tell on her mental health. It becomes anxious, a lot of other things. So because of the effect of PCOS, it can affect a woman's mental well-being eventually.
Okay. So how effective are lifestyle changes like diet and weight management in controlling PCOS? You spoke about exercising to lose weight, but what about the diet? Does it in any way,
Yes,
help?
the exercise and diet go together, and lifestyle modification is usually the first line treatment for PCOS, and they are very effective. But what we advocate for diet is a sustainable, feasible, and a practical diet regime. What we notice in our women, they tend to go to an extreme in trying to diet, a diet that cannot be sustained. Because what matters in PCOS is that weight reduction, and that should be sustained. Because if you lose weight, menses become regular, and you get back to your diet and gain more weight, the menses can still become irregular. So dieting and exercise are very effective. But for diet, it has to be sustainable, it has to be feasible, and it has to be practical and tailored to that individual, so as to attain sustainability for the diet.
Okay.
All right, thank you, doctor. And I would like to ask you how, for a person that just discovered to have PCOS, what are the right words that can be said to the person? Because of course, that a lot of us are really ignorant of things going on in our system, especially us women, right? And some of these things we know from old age, or from the olden days when our mothers would say, oh, it's normal, it's a woman thing, don't worry, you come over it. There's some women that have seen their period twice a month. Some people menstruate twice a month, normal 5 days twice a month. Some will say, oh, it's an ancient way of giving birth to twin later. What are the words that you would tell to a patient that makes the patient knows that this is not a death sentence? It can be treated and it can be managed.
Yes, we on a lighter hand, I always joke with women that come with PCOS after we have done all our investigation and assays, and we have found that infertility. And mind you, I tell you that presentations for PCOS varies. A woman can come in, her problem is just she wants to get pregnant. Another one, she has children, but she just wants to be seeing her menses regularly. And some will come in and tell you that she has these bad pimples and acne always around her. So it depends on what the woman presents with. For a woman to present with infertility, I always joke with them that if I was asked to choose a cause of infertility, I would have chosen PCOS, because to some extent it's the easiest. And one, two is usually something that can be managed. There are other causes of infertility that once you have it, the doctors, it's like a dead end. So for you to put on your patient, you tend to encourage and say, no, it's PCOS, strictly PCOS is something we can manage, something, not a death sentence, something that can be adequately treated and managed.
Okay, but doctor, I have this question. Why is public awareness of PCOS still, very low, despite its high prevalence? Because it's not been long I've found out about PCOS, and that's because I think few people have been posting things about it. So why is the public awareness very low? Why is it that a lot of people don't know about it? Some would have it before they get married, and they will not even know till they are married. So why is it low? What do you think it's the reason?
If you ask me, I wouldn't believe it you, but because we used to have women that come, adolescents, women even in the secondary school, they will come and tell you that right from the time they have this, because they are aware, they will tell you that I have PCOS. I will be the one to tell them that, what is your problem? They will tell you that they are afraid that when they get pregnant, when they are married, they may not take in early, or they will have problem. I would now tell them that don't worry, let us, when we reach the bridge, we'll cross it. So quite often, many women come. And the issue of awareness, I think, is a general issue because of illiteracy and our low awareness health and health-seeking behavior. But quite often, as a specialist, I see quite a number of young women even before they get married. Students, even students in secondary school, they will come and tell you that they have not been seeing our menses regularly and they know there's something like PCOS. Doctor, please, we want you to test me to see, is it PCOS I'm having? You know, your woman is not married, you can't be talking of infertility. All we can treat her for then is to make her menses regular and tell her to go when the time reaches and she's having that problem fertility, then we can now tackle it. So on my part, I wouldn't believe the awareness is low.
Okay.
It's not so low.
Okay, so what role can schools and primary health care centers play in early detection of PCOS?
Yes, I think it's this awareness. Awareness can never be too much. Education and awareness, health education, especially in secondary schools, because it's a female thing. Once you get the patient, the children or the pupils or the ladies on board before time, let them know there is an entity known as PCOS, and this is how it can present, and these are the consequences when not managed. I think eventually, immediately they start having something that looks like that, they will come out, and then on our part, we try and see and diagnose and make sure it is really the PCOS, or because there can be other causes of what she's presenting with. So I think health education to intensify. If we are doing it, we have to intensify health education and also at the primary health centers, because the specialists are very few. It's very few patients. And maybe that's why I'm talking the awareness is low, because we tend to see patients that are very enlightened before they reach us. They will have gone so round. We do see quite a number of patients that are quite aware of what PCOS is.
Okay. So, doctor, how can women with PCOS advocate for better care and support, within the healthcare system?
Yes. And I want to give you kudos for this program. And though you are not, because this program now will go a long way rally around women that have similar symptoms that we have just talked about. They have to come out, rally each other around and create awareness, create groups, just the way you are doing a great job with the pre-eclampsia awareness. They can also bring up those issues, share ideas, and also share their history and success stories. It will go a long way in dousing tension and allaying anxieties, so that they will know that PCOS is an entity, it's not a death sentence. It's something that is treatable, it's something that can be adequately managed.
Thank you so much, Doctor. Okay, so I have two questions before we wrap up. Before I call out, let me call out the phone number before I ask the remaining questions. 09032229797. I take it slowly. 09032229797 or 08182222205. Send us WhatsApp messages on 08182222205. We have two messages already. Oh, three. The third one just came in. Doctor, before I read out the questions, are there any promising research developments or emerging treatments for PCOS on the horizon?
I think the most challenging aspect of PCOS is weight reduction, because it's easier said, and that's why I said even dieting. I see a lot of patients. Dieting has to be very practical. So there is a lot of research going into the aspect of weight reduction. We have surgeries known as bariatric surgeries that can be done to reduce weight, because dramatically, once a woman reduces weight, all the menstrual irregularity and ovulation associated with, and the main pathogenesis of PCOS revolves around obesity, hyperandrogenism, and hyperinsulinemia. So once a woman is being able to control her weight in terms of bringing up less tedious ways of achieving weight control or weight reduction. One of them, as I say, is the bariatric surgeries, and which can also be done laparoscopically currently.
Okay, so Doctor, we have from the WhatsApp messages. Good afternoon, Citizen FM. Thank you, Doctor, for the enlightenment. My question is, does PCOS has anything to do with age? Someone is asking, Doctor.
No, age has nothing to do with PCOS.
Okay.
All PCOS has something to do with is weight. We realize that some women they usually it's what PCOS causes is secondary amenorrhea. So women may start their marriage, they will have one or two kids. When they, most of women, African women, believe weight gain is a sign of good living. When they start adding so much weight, they now lapse into PCOS. They start having menstrual irregularity, they start having infertility. So age has nothing to do with PCOS.
Okay.
PCOS over time, it's because she has added weight, not because of the age.
Okay, the second comment here said, "Good afternoon. I'm listening live from Duty. Thank you for listening." And she's saying, "This is my first time of hearing about PCOS. I am glad I tuned in today." Good afternoon. Thank you so much for tuning in. And the last message, good afternoon, Doctor. Good afternoon, Aisha and Esther.
Good afternoon.
It's a very interesting conversation. But how can technology like healthcare apps and telemedicine support women managing PCOS?
Yes, there is a lot of grounds yet to be covered by technology. In fact, hope with in recent years to come, a lot of things like telemedicine. In fact, we have telemedicine platforms where you can have your own doctors anytime you have questions, and it's safer and much more robust than just throwing questions to Google and being answered by random people or random specialists that you don't know. So again, telemedicine and apps. There are even apps for PCOS, apps that you will try to input your menstrual cycle dates and also other signs that you're having. I will make a prediction for you for PCOS, but that will not be as good as coming out to the hospital and being treated, because there are some of those diagnoses that need laboratory confirmation before a diagnosis can be made.
Okay, thank you so much, Doctor. Esther, I don't know if you have any question before we wrap up.
Doctor, I just want to say thank you for always being available whenever we'll call out to you. And then my very last question is there similarities between PCOS and hormonal imbalance?
In fact, there is, because most people at the laymen or laywomen refers to PCOS as hormonal imbalance. Because PCOS, one of the ways it causes its problem is by causing an imbalance in the hormones. As I said, there are excess male hormones, androgens. The woman is not supposed to have excess of a male hormone. That's a hormonal imbalance. You may have also excess of what they call a luteinizing hormone, and that's what leads to her not ovulating. So yes, it can be synonymous, or most times when the woman has a hormonal imbalance, it may mean that she has PCOS.
Okay, thank you so much, Doctor. Is there anything you would like to add before we wrap up the show?
So it's just to add the word that PCOS is a syndrome, and management is tailored to the presentation. And even the infertility is not the end of the road. When the woman has infertility due to PCOS, it can be managed, it can be taken care of, but she needs to visit a specialist where the best and appropriate care can be given to her.
Thank you very much, Doctor.
Thank you, Doctor.
Thank you so much for being part of the program, Dr. Aliyu Chapa, for all the explanations you give us today. It's been very, very wonderful. We appreciate you, and we hope to have you on this same show, same time. Very soon on this same show. Thank you so much for being part of the package. My name is Aisha Shoaibu Badegi, and I want to leave you with this saying that your health is very important. Do well to go to the hospital when you feel anything in your body that is not normal. Run to the hospital. Use your legs and run there. Esther, what's your last word?
Yes, and I would like to say health is indeed wealth. Do not ignore it for any reason. And I know now a lot of people say it's so expensive to go to the hospital. That's why we have insurance companies.
Right.
Just, register for one. Take care of your health. It's very important. My name is Esther, but you can call me your mini celebrity. Good afternoon, Abuja.
Good afternoon, Abuja.